Toss aside the touchy-feely notions of love in business and recognize the real power it holds. Welcome to the Love is Just Damn Good Business podcast with host Steve Farber. Drawing on his work with a wide variety of companies from the Fortune 100 to smaller family-owned businesses, Farber shares inspiring interviews with business leaders and proven strategies for how you can create experiences that your customers will love by developing a culture that your employees, teammates, and colleagues love working in. Discover why and how love, at the end of the day, is just damn good business for you too. Here's your host, Steve Farber.
So, Caitlin Stella, welcome to Love is Just Damn Good Business podcast. It's great to see you here.
Thank you for having me, Steve. I'm happy to be here.
So, I want to hear about what you guys are doing at the hospital. But first, tell us a little bit about your kind of personal and professional journey that brought you to this role.
Okay, sure. So I actually started my career in healthcare as a volunteer, if you really want to go way back in time. And I worked in hospitals in my hometown in Pittsburgh as a volunteer, and I really loved being around the kids. I liked the pediatric component. And I'm also one of 7 children. My mom's a teacher. She taught special ed, she taught preschool, and then she raised 7 kids. And my mom's one of 7, my dad's one of 7. Kids kind of like rule the roost in my family. And so I loved that and decided to study child development in college. So I studied that in Virginia. And then I decided to go to LA and try to get into graduate school at UCLA. And before I wanted to apply to the program, I wanted to get residency. So I started working at UCLA in a research lab, essentially. At first it was a lab, and then it was a research program. And it was in about 1999 when the National Institutes for Health issued big grants for autism research. And so I was in an autism research group, and we wanted to put in a grant to become a center of excellence. And I was actually the person who kind of orchestrated the whole grant. And then I was kind of made the administrator of the program. So I ran the center. So it was called the Center for Autism Research and Treatment. And it was a big center. We had lots of research going on in different areas: pharmacology, functional imaging, genetics, all kinds of things. And then we also had a clinic. So we trained psychologists, psychiatrists, all kinds of different types of physicians and other types of trainees like audiology, speech, psychology. And then we had, just a very big community advisory kind of group that I organized because I really wanted parents to help us lead where the direction of the center. It was kind of a time in autism where there weren't a lot of resources, there weren't a lot of things paid for by insurance. Families were trying to find answers. UCLA was one of the few places in the country or in the world that you could go and even get a diagnosis. And so I felt very strongly that as we evolved the center, we should include the families. And then I just got really involved in the autism community, and we made a lot of good change. So that was a great part of my career because I really did learn about what families go through when they're seeking care. And then I experienced it in my own family with family members that were patients. And healthcare is a really difficult, like sort of business, if you will, or construct organization to navigate. So I watched it firsthand. And so I went into consulting because I wanted to try to learn the healthcare system and like see how I could use my career to, quote, fix the healthcare system or make it easier for families. And so I went and worked, I left UCLA and I went to PricewaterhouseCoopers, and I was a consultant for them. And I worked in the national healthcare practice. And I learned the system. I worked in about 23 different healthcare systems in 5 or 6 years, and I really learned both sides, all sides. Spent a lot of time trying to stay focused on pediatrics because I knew I wanted to go back to that. But I learned the insurance side, the pharmaceutical companies, biotech, hospitals, finance, all the federal programs like Medicare, Medicaid. And then I decided to get off the road and went to Children's Hospital Los Angeles full time, where we were building a brand new hospital. So that was like the first time I built a hospital, and it was a great experience. And then I was part of a group of people that created a community network there. So similar themes in my career. And then I got recruited to go to UCLA again, and this time at a much higher level. And my original autism center that I had helped build in 1999 reported to me when I went back. So I was the CAO for women's and children's services. So I had all of those programs. And so my same team was then reporting to me. That was kind of funny. 20 years later.
That's great. Well, that were still there that worked with you before.
Oh yeah. Yeah. And I had kept in touch with almost all of them. So when I came back, they were so happy. And I was happy to have them with me. But yeah, a lot of them, they've lived their whole careers doing research, especially the director of the center. He was one of the early geneticists. Like when we started the center, he was junior level in his career, like just getting started. And then now he's like an international expert. He fundraises, he works with the government. Like he's done a million things and he's still there. So we laughed that like we both kind of grew up and ended up back together again.
So I'm curious, when we started out with a research, you started out with a research focus.
Mm-hmm.
So in that field, is that, a lot of times I think the connotation of research is, white coat in a lab
Mm-hmm.
with test tubes, no direct contact with actual human beings.
Yeah, no,
But that wasn't the case with your kind of research.
Well, we had within the center, we had different kinds of research happening. So there were definitely like white coat labs for the genetics team. Like, for example, the person I was just talking about, they had like a real wet lab. And so they were, doing studies like that. We also had a pharmacological lab that had like animal models where they were testing some of the psychotropic drugs to see if they could get. So we had different kinds of labs. The one I worked most closely in, there were two really. One was a behavioral interventional lab. So kids with like emotional issues would come in, and we had studies going about things like attachment theory and whether or not there were attachment issues with the parents and what they were, and could you affect change, or language development, which, all the things that are like hallmarks of autism. We had different people doing social and psychological research that were studying the behavioral aspects. Some of the kids were in more than one study. Like we had some kids that had like, for example, autism has a high correlation with epilepsy. So like, we had a neurologist who she and I are still friends too. She's in Boston. And, so she studied the kids and their behavioral issues and also their epilepsy. And she was using medications to see if that would help both the epilepsy and the autism. So there were a lot of different kinds of studies. The other one that I was very involved in was epidemiology, because like my background's in public health. My master's is from UCLA. I eventually went back and got it while I was working at the center. And so I was very focused on the prevalence in California. Like you're in California, you may remember this, that there were pockets of like high prevalence of autism in like Silicon Valley and Silicon Beach, essentially. And there was a whole study around, was there an environmental issue? Were there pollutants in the water, land, whatever? Or were there things like genetic correlations? And we were trying to figure out, why are the numbers of children going up exponentially in these areas? So I ran the Southern California part of the state study, and I had a peer that ran the Northern California part of the state study, and then all of our data was put together and published. We published it in 2002, I think.
What did you find?
It was interesting. The conclusion was that essentially that the DSM, which is the Diagnostic and Statistical Manual for psych diagnoses, had changed the criteria for autism spectrum disorders. So the original criteria was very strict, like kids had to have really a variety of different, phenotypes of like how they were expressing this behavior in order to have an autism diagnosis. That's why so many families were lost in those early years of my career, because your child might have had one or two, but not all. So they couldn't give you an autism diagnosis, and then you couldn't get services. When the spectrum became a concept, and now we all know it as the autism spectrum
Sure.
disorders, that was the early days where they changed the definition. And so many, many more children qualified as autism spectrum disorders, ASD, versus autism. So that's why we were just seeing these extreme numbers of kids. There were other studies that did find things that were genetically based, and I don't remember the conclusive evidence about an environmental issue. I definitely lived through the vaccination MMR theory, which was, debunked, and the person who put it out there ended up losing his license and going to jail in the UK. But after doing a lot of damage to families who thought the MMR was causing autism, and then it really set us on this course of anti-vaxxing, and then, look what we've been living through, right? So I definitely that was the kind of prime time of my career watching that happen.
So you went from that research base, and then at your time at PwC, you started learning more of the landscape, more of the so-called administrative end of things. At any time when you were doing that work, did you ever have a personal vision for yourself that said, someday I'm going to integrate all of this stuff into one role? Or were you just pursuing what interested you at the time?
I would say not in a formal way. I never really said I actually try to counsel students, especially because I've had lots of interns over the year, try not to pigeonhole yourself. This is what you're going to end up doing. And then if you don't, you're disappointed because other opportunities come up along the way. So I never really thought that. I do believe, and I still believe, that with every opportunity that came my way, it was building onto something else. So I was building up to something, I was accumulating these skills and experiences and this network of people that kept showing up in my career. I knew I was doing the right thing because I was doing well, I was happy, I was growing, and I was interfacing with the same people that were very like-minded. I think if there was one thing I had as a personal mission, it was that healthcare shouldn't be this difficult to get, and it shouldn't be this difficult to understand or navigate. And when you have a child, especially, this is true for all family members. I've had adult, issues in my family too. But with a child, especially, children are not supposed to get sick. They're supposed to be healthy and growing. And so when they have an issue, it makes it that much more stressful for a family. And parents, when you have other children that are well, you don't know this world I live in. Thank God you don't know how it is to try to get into a specialist, or how to have to take your kids to therapy every other day and make it work with your job. And I have families who have children on ventilators and feeding tubes. And so if you have well children, you never live in my world. But every once in a while, your kid needs something, and it is the scariest thing ever. And I just always felt like I was going to work my whole career to build a system that was easy and that was the least amount of stress possible. That was kind of my only mission in life, and that the skills that I was going to gain were going to do that. That's what I was going to do.
So it sounds like, from the way you described your early work with autism and bringing the families in to that whole dynamic, which sounds kind of obvious, right, to a lay person, but in a world where people are very disease and all of that is kind of categorized, and it's very easy to lose sight of the human element, ironically. So your awareness of the family dynamic played in really early.
Oh yes.
And
yes.
And it's, again, with children, it seems kind of obvious because they have no other choice. Their parents have to take them, but to their appointments and all that. But in healthcare in general, isn't that always true? Isn't for adults, even though, you could drive yourself to a hospital or to an appointment. Shouldn't the family be part of that? If there is a family for that person, shouldn't the family be part of that whole scenario right from the beginning?
I mean, that's what you and I believe, but not everybody functions that way. I will say medicine has evolved, even over the course of my career. But, there was a time in medicine, even before my time, where the doctor just told you what you were going to do, and that was that, and this is the way you treat it. And there's a whole history of medicine where it was dictated to you, if you will. That's what makes it so strange. It's a very weird economy where you, as the person that has to you're the recipient, you don't decide what's happening to you, and you don't pay for it to a degree. Like the insurance is dictating part of it, and your doctor is dictating part of it, and you're just like the recipient out of control. Like, it's kind of a weird way to think of healthcare, but that is very much what it is, and that's what makes it so scary, because you're in a hospital and there are rules, and there are people doing things to you, and you have no control. It's like, this is how we do things. We do your labs at 3:00 in the morning, and that's what we do. And so, I mean, I think you and I find that to be very much commonsensical, that the family is integral. But I think I learned with the autism families early on it was something so much more deep, because they were advocates. They were the ones that were the only ones that really understood their child completely. I think that was lesson number one. Every kid was different. It is a spectrum disorder. So, you might be here and I might be here. And the only person that could really know the nuances around each of our behavior, even if we have the same diagnosis, were our families.
Right.
So there were lots of parents that would tell us, no, I mean, he can do that if you say it this way, or he can do that if you, approach it that way. And some people listened and some people didn't. I mean, there were some people who thought they knew better. They were experts in autism, so they were going to tell you, but I just remember that early on thinking, why aren't you listening to this mom? She knows this child better than all of us, so it was a good lesson that, medicine doesn't always know. Sometimes the family knows best. They were also advocating for their services. When the insurance company didn't pay for things like speech, but you knew your child did well and would do well if they just had speech, you had to fight for it, and they advocated for the needs. They knew their children better than anybody else. They advocated at the state level. They advocated at the federal level. That's how the grants that I got came to be. I mean, we got a grant at UCLA because parents went to Congress. So you start to realize that, the people who have the most skin in the game are the ones that you want on your side. And that's why when I started the Autism Center with the team and I was the administrator, I said to them, the first thing we're going to do is have a parent advisory organization, or council, or a committee. And I had people who said, I mean, really, do we really need that? Isn't that going to make things more complicated? And I'm like, well, they're the recipient. So if we're not working in the direction of things that they need, I mean, eventually everyone was like, yeah, this is the way we do things at the center. But it wasn't commonsensical then,
It was a little out of the box at the time.
It was definitely out of the box. Yeah. And, but I think that a lot of healthcare organizations have evolved past that. Patient family-centered care has taken on a whole new element within healthcare, but it wasn't always like that. We have to remember that.
Are you seeing it's a bit of a tangent, but just out of curiosity, are you seeing a difference in younger docs, younger healthcare givers coming into the world in terms of their attitude? Yeah, absolutely.
And I will say, it's not even a function of age. I think it's just the trainees in any, that's just how you're trained now. I think you're trained with more sensitivity and more awareness of the involvement of the family, especially in pediatrics. I had a woman the other day, she switched careers. So she became a dietitian after being in marketing for 20 years. And so she's much more open because the training that she's received, so it's not really about age, it's about the newer way of doing things. Is how do you integrate with the family? How do you involve with the family? How do you communicate with the family? that was not the way that previous training programs, the focus was more on the science and the medicine and how to give the treatment.
Yeah, I don't know if age is the right word. Maybe it's generational. Maybe it's, the healthcare providers that came out of that very transactional world that you were just describing, and very one way. I tell you, I do the, you just do what I tell you, and the insurance company will decide whether or not that's allowed. That attitude, shifting into, let's get the family involved, or even without family involvement, it's let's get the patient involved.
Yeah.
In terms of a dialogue, like I'm seeing 100%. That the reason, I'm experiencing this. I just got a new primary care doc, and he's young. He's like in his early 30s. And in my first consult with him, it was a dialogue.
Yeah.
And he actually said to me, I couldn't believe this. He actually said to me, all that work that you're doing, kind of scoping things out online and looking at the labels on your supplements. And he said, that's really helpful. That really helps me to figure out what to do with you. And I thought, I never heard a doctor say that before.
Yeah, usually they're like, why are you Googling that? I'll tell you what to take.
I'm the doctor. Or you could call your doctor.
No,
instead of going to Google.
It's so different now. And I'm telling you, I think it has everything to do with what residency programs and training programs have started to incorporate into how they function, and how they train. And I definitely see it. And it was really interesting is COVID was such an experiment about what happens when you take the family away, and so like every hospital in the country had to narrow down visitation, right?
Right.
Okay. So, now of course in a children's hospital, there always has to be at least one parent or caregiver or legal guardian like at the bedside, because you need consent and buy-in to do certain things. But in the adult world, many places, many parts of the hospital had no visitation, and especially in a COVID unit. Even if you weren't on a ventilator, you were just sick, you were completely isolated. So it's interesting. We saw, and I'm saying we, community of healthcare globally, saw an increase in major safety events, major quality issues, more infections, more this, more that, because and there are theories out there. This is not just me making it up. That you didn't have family advocates there to say, why are you here? Why are you doing that? Wash your hands. I mean, you have heavily medicated patients sometimes, and without somebody at the bedside to say, I remember when my own husband had surgery, and I was like, wash your hands. Who are you? Did they just came here and gave him that? And, oh, sorry, So you have to just, without somebody there who knows the patient, a lot of things go wrong. And that is exactly what has happened over the last 2 years during COVID.
I want to come back to that, but now let's bring you to Joe DiMaggio.
Okay.
So what is it that brought you there? And when?
Love, of course. So, ironically, my husband is actually from this area, but we were living in California, happy, not really looking to move. And somebody who I knew, who was a recruiter, called me and described, I had described to her at one point in time, I was like, this is the kind of place that I would only really leave for, and I don't really think it even exists. And she called me and said, I think I found it. Like, you've got to check.
So what were those characteristics what were the characteristics?
Oh, yeah. Okay. So this is why I thought they didn't exist. So number one is it had to be an organization that always does the right thing for patients. Like, and that sounds like, again, no brainer, common sense. Like, you're like, why would that even matter? But you got to remember that, just like every other business, sometimes healthcare makes decisions based on other needs. Like if you're in academic institutions, sometimes it's about what the training program needs or whatever, research, whatever. But I just felt like I wanted to be somewhere where the patient and patient care, clinical care was the most important thing, not other tangential like publishing papers or being famous for getting grants or whatever. and I'm not bad mouthing that at all, because it was a great experience. And those organizations are wonderful places that innovate and develop treatments. But I think as I get kind of further along in my career, and if I had one mission, it was really about making the patient care experience easier. I wanted to be somewhere where if I really felt strongly that something needed to happen for patients, then they would get behind me, without a fight.
Right.
And then the other one was about payment. So children's hospitals don't make money, generally speaking. They have a very heavy Medicaid population, because many children with chronic healthcare needs are on state Medicaid programs, and they don't tend to pay. So when you're in a system, or you're in a place where pediatrics isn't very profitable, it's hard to get resources. But they're also the populations that need them the most, because they become your chronic population. Sometimes it's stay in a health system. So if you do a good job with them as kids and you get them plugged in, ultimately over time, that's really what population health is. It's managing disease over time. And so I wanted to be in a place that was going to be open to doing things that didn't necessarily make money, but were good for quality, safety, population health, and for children's health. Like, just ethically and culturally, it just really had to be about that. And it sounds kind of crazy, but it's sort of hard to find, because, most children's hospitals still have to be able to cover their costs and operations, and they rely heavily on philanthropy, as do we. But I think it's really just more about the organizational culture, that it was really just going to be all about the children. So the recruiter described to me the hospital, and I said, yeah, I know that place, because, I'm part of the National Children's Hospital, and I know the logo. Okay. So my logo, I'm kind of pointing to it. Mm-hmm. It's a little baseball glove with a heart in the middle. It's like the cutest logo ever. Right. And I said, oh, that's the place with the clown. They have a full-time clown. And she said, yes, they have a full-time clown. And again, as a pediatric administrator, and to have a full-time clown, no insurance company pays for that. But every child is looking for that resource. That's like their friendly face in the hospital that's not going to give them a shot, and not going to give them an IV, and not going to, And so I was like,
just to be clear, a lot of organizations have full-time clowns, but of a different sort. So
yeah, okay, you said it, I didn't.
So you're talking about she's an actual clown.
Yes. And I will say that I knew her as that. I knew it as the hospital that employed one, because no other children's hospital that I had known employed one. There were plenty of nonprofits and things like that, organizations that came in and volunteered and juggled and blew bubbles and whatever. But this was different, and I couldn't understand it just yet. But then when I got here, that's when I started to realize what it really was. And that's when the whole experience of realizing that, this is that place, that recruiter was right. This is that place. And the clown, who's much more than a clown, by the way, her name is Lotsie Dotsy, and she was a respiratory therapist who was taking care of children for many years and was trying to get them to do their breathing exercises. And instead of trying to get them to use the little thing where they, blow and the little ball moves or whatever, she would use a harmonica, and then she would use balloons, and she would get them to do their breathing exercises with things that were fun for kids. And it's, again, it seems no brainer, but she, one of the kids said, why can't you be Lotsie all the time? You need to be Lotsie all the time for all the kids. And so she went to clown school and she became a local college had a clowning program. And she learned all these techniques, and then went to the CEO of DiMaggio and said, I really think I need to be a full-time support to the Child Life Resources, the Child Life program, because every children's hospitals tend to have people who just focus on the children's experience, but not all of them are like my program. This is different. And so, so the CEO said, yes, of course you should. We need to make you a full-time therapeutic clown. So she has been a therapeutic clown for 30 years. She's been here for 40.
Wow.
And
so wait a minute. So how long ago was that the CEO?
Talk about foresight. That was 30 years ago.
30 years ago. Oh, yes. My gosh.
So, and Joe DiMaggio has been like a children's hospital, officially a children's hospital for 28. So she was a respiratory therapist working in different areas, and then she became fully dedicated to the children's hospital. And then 2 years later, it becomes a real children's hospital. So she's been here as long as the children's hospital and then some. So when people ask me, why does Joe D have this culture? I think it's because everybody, this isn't the only reason, but everybody that we hire has a little bit of her inside them. Like, we're all willing to get on the floor and play. We're all willing to be there to sing happy birthday. We're all willing to be there and sing the song when they go home. It's everybody. And it's not just her, it's the physicians, it's the nurses, it's me, like, all of our team, like, because we're all about the kids. Just like she's all about the kids and their experience. We want them to come here and feel comfortable. We want them to come here and feel unafraid. We don't want them to be scared to come back. That we want them to think of these friends that they met. And, she keeps in touch with these kids. I mean, so Lottie is like, I think, a symbol of Joe DiMaggio's way of taking care of the children that we take care of in the community. And
so when did you join?
I came 4 years ago almost. It'll be 4 years.
And you came in as the CEO?
Yes.
Okay.
Yes.
So you came into a place that was already built on love, from what you could tell,
For sure.
from the logo to the clown and everything in between.
Yes.
So since you've been there,
Mhm.
and have, had, needless to say, direct experience of that culture, what have you guys been doing to evolve that even further?
Mhm.
So
Well, that's been my whole approach is, don't mess with what's working, right? And there's a lot that's working. And, beyond Lottie, she's part of a team of child life specialists. Like I said, a lot of children's hospitals have them. What they are their child developmentalists, like how I trained, but they're usually masters, most of them. And they are very much there just to help the children cope and understand what's happening to them and explain things in a way they understand. So, if you get diagnosed with cancer at age 4, Child Life explains it to you differently than if you're 14. They'll help you
Right.
kind of understand what's going to happen to you. You're going to get a port. Try explaining a port to a 3-year-old, stuff like that. So we have a very large Child Life program, but when I came in, what I did was I kind of like adopted it. I adopted the whole department. It was Lottie, it was them, it was our therapy dog. I just felt like we need to take this program and like crank it. Like, that is so much of what people remember here. So we need to spread it even further, because that makes the children's experience positive. Like that's how I look at it. Those child life specialists, they don't poke them, prod them, give them IVs. They don't give them medication. They don't do things to them that they don't want to. They're their friends. It's like having a buddy in the hospital that's going to help you understand what's happening to you. Then you have Lottie, who's, again, familiar face. She's there to make you smile. We have our dog who comes and visits. And so what I've been doing the last years is like trying to like amplify that, add to it. We've tripled the size of the team. They're everywhere in the hospital now. Some areas didn't have one, like radiology. That was a big one for me. Do you know how scary it is to get an MRI when you're like 4, and
or 60.
Or 60, exactly. And that's just it. So like, we have to have these people in these areas where it could be traumatic. Like, that we had partial coverage here and partial coverage there, because again, these are the things you don't get paid for. No insurance company is paying you extra to have these things. But what we're doing is mitigating trauma, mitigating stress, and we're actually giving better quality care because, for example, in radiology, we track our data with a lot of other children's hospitals. We give less sedation and less anesthesia than most of the national children's hospitals because we have people in there supporting the child. Like, if you want the dog in the room, dog's in the room. If you want Lottie to help sing you a song, and you're relaxed, and then someone's in there talking to you, or you're watching a movie, or you don't need anesthesia. So all of our risks go down, and then the kids don't have to get an IV, so there's like a method to the madness. And then, when they come in, they get toys. When they leave, they get toys. They get phone calls beforehand from us, phone calls afterward from us. And especially now, what we've been able to do with our child life team now that we have enough people is we call the kids ahead of time. So, oh, hey, you're coming to visit us at Joe DiMaggio. You're going to come have surgery. We're so excited. What's your favorite toy? What's your favorite color? What's your favorite show? So by the time they get here, their room is set up. It's like going to the Ritz-Carlton or something where they know you like flowers. So they put flowers in your room, or like, they know you, whatever. It's the same concept, that you're just that much more comfortable because there are familiar faces and there is comfort in the environment. And that just gets the ball rolling. And then every single friend you make along the way is just that much more focused on your needs. That's what I feel like is the difference. Like, it's all about the kids in the end. And there is a reason for that. Joe DiMaggio is the first children's hospital in the world to get certification from an organization called Plaintree. I guarantee you've never heard of it, but Plaintree is an organization that's about person-centered design. So the reason we were the only children's hospital to get it is because every single thing in the children's hospital is designed around the child and the family, but more the child first, but the family also. We have parent advisors, we have parent mentors, we have youth advisors, youth mentors. They are involved in decision-making. They are involved in design of space. They're on quality committees. They're on strategic planning committees. They've created programs with us. I mean, they're involved. And it's exactly like my autism days. Like, the parents were there every step of the way, and they helped us to become a world-class center. And it's the same thing here. Like, the parents and the families are here. The children are here with us every step of the way, making decisions about how we do things. And that's why it's so comfortable. Like, if you call for room service, we have 24/7 room service. As long as it's on your diet, you can have anything, anytime. So if you call up and you want like dinosaur nuggets, or you want star-shaped nuggets or heart-shaped nuggets, like, we have them, and you're happy, and you'll eat, and you'll be healthy, and then you'll get to go home. So that's the whole point, just making it a place they enjoy.
So it's a big leap from making a hospital experience a place they're not afraid of to a place that they enjoy.
Mm-hmm. I know, but we have more kids. Do you actually
have kids coming in there saying who are actually excited?
Yes.
To be there?
Absolutely. And I have more kids crying on the way out because they want to stay than I have crying on the way out because they're traumatized. So I'm just telling you, when you stand at our valet, and every once in a while I'll do it just for fun, I will ask, are they upset? Is there anything we can do? What's going on? And the parents, moms, babysitters, whoever, they want to stay.
Oh my gosh.
And like some of them, especially the regulars, like when they walk in, they're looking for certain things. They want to see this person. They want to see that person. They want to see Miss Rosie because she draws their blood. And Miss Rosie, by the way, is known because Miss Rosie uses little teeny tiny needles that are different than the big needles. So like, you or I want to go to Miss Rosie too,
I do.
Like, and that's what I'm saying. The kids know that. She sings to them. She talks them through it. She explains everything she's doing. Sometimes she can get blood that everybody else gets out of your arm, out of your finger. So you love Miss Rosie, mom loves Miss Rosie. Like, so we just have all these little things along the way that the parents will say, I love this place, and the kids are like, looking for their friends. And I'm not kidding. Like, there are more kids that are upset because they're leaving than the ones that are like upset because they had a bad experience here, or they were, scared. So we like it that way. I always tell my team, I'm like, that's a good review.
Yeah, I would say so.
That's
an understatement.
Yeah.
So when you compare the Joe DiMaggio experience with kind of your let's call it typical children's hospital.
Yeah.
Are a lot of children's hospitals doing similar things now, or what is the difference?
The way I always describe it is, it's like everywhere. It's a cultural thing, either the culture of the organization breeds this kind of environment where everybody's empowered to do the right thing. Everybody can get on the floor and play, and everybody, like that kind of, or it's not, it's like, it's more formalized, or it's more academic in terms, and that's not a bad thing, but like more hierarchical, or, like, like I don't wear suits, put it that way. Like in the hospital, I don't wear suits because I look like a suit, and kids don't like people in suits, and we don't wear white coats because kids don't like people in white coats. And like, so there are plenty of other children's hospitals that have beautiful buildings. They have great programs. They have great physicians and nurses and all the care team members, just like we do. But the approach is not always the same. I have to say, in all my years in consulting and in being in pediatrics for this many years, I know we're different. And anybody that's been anywhere else knows we're different, because we have plenty of families that come from other children's hospitals nearby, and they come to us because they've heard the experience is different, or they access us through our Kids-Years. Our Kids-Years program is a service that's there. It's like my dream program. It was just to make it easy for you. It was someone
Did you
could
say
call.
Kids-Years?
Kids-Years,
Like
yeah.
concierge?
Yeah.
Kids-Years. Okay.
Yeah. And I actually said to my husband at one time, I was like, the hospital that I go to that lets me do this is the right place for me, because that was my mission from the beginning. Healthcare shouldn't be that difficult. Why is it so hard to navigate? I mean, I'm taking one day off of work. Can I have all my appointments on one day? Taking my kid out of school. Can I have all their appointments on one day? I mean, it's so hard to navigate from behind the scenes. And if you don't have an advocate on the inside doing it for you, you're just at the mercy of a system that's broken,
So what is the Kids-Years?
Yeah, the Kids-Years is just amazing. So what it does is a few things. It's essentially, if you go to our website and you're like, do you have a special request? Do you have a special need? Contact the Kids-Years. So it can be pretty much anything, but most of the requests are things like, I need to get an appointment with an XYZ now, like I'm worried and my child is not well, and I called the office and they said the first appointment's in May. So we get some of that, and then we can move them up. We can work with the teams, find them a way to get in sooner, maybe a different location. We'll get them in, right? Or another common one is what I said before, like, the kid's going to come for imaging and see genetics and see neurology, and like, can't anyone orchestrate this for me? So I only have to take one day of my life to do this, or sometimes it's the opposite. Sometimes we're trying to do too much in a day, and the parent will say, he can't handle that, or she can't handle that. Like, can you break the appointments up on this day and that day? And then we'll call the physicians, or we'll call the team and say, what do you need to happen when? And then we'll break it up. So like, with like a 2-year-old, I mean, a terrible 2-year-old, like, good luck getting them to go see more than one specialist in a day, So sometimes it's the parent's request to do the opposite, smaller bursts of time. Sometimes they're coming from out of town, and so they need housing, and we have free housing at DiMaggio, but we have to, help them book the rooms, how many people, that kind of thing. Was we have a hotel on campus called the Conine Clubhouse. That's where Jeff Conine, who was a Florida Marlin, and he and his wife, Cindy Conine, have been fundraising for a long time, free housing. So we book that. Or if they have extended family coming, we help them find housing, short-term, long-term. Sometimes they've never been to DiMaggio and they don't even know who to see. So they contact the Kids-Years, and the Kids-Years said, okay, this is the diagnosis. We'll send you here. They're going to want you to do XYZ. And then we get all their medical records from wherever they're coming from. We get the medical records to our team. So by the time the family shows up there, we already know them, versus like either starting from scratch, We also have a formal relationship with Boston Children's Hospital. Boston's #1 in the country. And so sometimes we send kids up there if they have like super, super rare diseases or something. And so the Kids-Years orchestrates everything. The family goes up there, they see Boston, they come back, and the team works together through the Kids-Years so that they're managing the patient together. So it's just a really unique, it's pretty much anything, we've had a variety of different asks come through there, even simple things like, my child's really scared. Do you guys have a program, or I'm really nervous. Do you have a program? So we have teddy bear tours, so they can come in advance and they can tour with their teddy bear. We show their teddy bear around. Sometimes the parents just want to like see what the room looks like or see what the, so we can do things like that if there's a request there too. So just sky's the limit. We just want it to be an accessible. It's like I'm behind the scene. Like if you needed a favor, if you know somebody in this market and you're like, oh, I can text Caitlin. Hey, Caitlin, I know someone comes to your hotel or your hospital. Can you help me? It sounds like a hotel. And I'll say, yeah, sure. Let me do that from behind. No problem. So you have me. Some people have no one, and that's how I always felt. Like I was always doing things for people behind the scenes. And I felt like that should be something everybody gets, not just you because you know me. Or not just donors, or I don't believe in that. I think anybody who needs a special request that's going to, make the stay easier, make their situation easier, then we need to do it. And that's why we lead with love.
So let's let me build on that.
Yeah.
So to what degree, I mean, to me, through my lens,
Mhm.
everything you just said answers the question, what should love look like in the way that we operate? Which is one of my favorite questions, and it's one that I always pose to my clients and everything else. Everything you just said is an answer to that question. Do you approach it overtly as love? I mean, I know I see it's obviously part of your logo and all that, but is
Right.
this an intentional, overt declaration that says we want to operate on the basis of love around here, or is it just something that
Yeah.
it you could call it that if you
Mhm.
wanted to, but we actually don't?
No, it's overt. It's overt. It's on everything. It's like we even have a little special thing that we use that says lead with love, like meaning that, when we onboard people, new employees, okay, and they come for orientation, I go to the new employee orientation, and so does my administrative team. And there are several things we talk about. And I try to leave them with a few things. And the primary things are really just about, you're in a place that does the right thing. This goes back to like, why did I come here? Like, you're in the place that does the right thing for patient care. Always. If you do the right thing, you are fully empowered to do the right thing. And we are always going to have your back. So don't worry about, well, I don't know if I'm allowed to do that. If you're doing the right thing, we're going to back you up, or we're going to help you do the right thing. So whatever that means, like, just remember that about patient care, safety, quality, always the first priority, right? So they start to feel like, okay, I'm empowered, I'm protected if I, report something or whatever. And then beyond that, I always tell them, like, every single person influences someone else in this building, right? So like, you could open a door for somebody that's a parent trying to get through the door with a stroller and a baby, and you can either let the door slam or keep the door open. And so you influence their experience in the building because you choose to help or you choose to serve, right? And I always tell them that anybody that influences anything is a leader. So that means everybody's a leader. Like, everybody, the valet is a leader. The valet is here, help the kids in and out of the car. They help make sure the car seats are, whatever, they're safe. They're in there. Like, they help load the strollers. They're getting bags. I mean, they don't have to do that, but they do. And so, it's every single role along the way. If everybody sees themselves as a leader, then they're influencing that experience every step of the way. And that's what we try to leave them with, like on orientation, is that you are a leader. So here we lead with love. Here we start with, what is the thing that I could do? What's the thing I can choose to do right now that is in the best interest of this child, this family, or my team? And if you choose that and you lead with love, everything else is going to follow, because that family is going to feel it. And we actually have people that have said that. Like, it's funny, when I was like, when I was like putting this all together in my head, when I'm like, yeah, it's on the logo. I mean, we function this way, but it's also, we see it every day, everywhere. If we just use that as a reminder with the little heart on the glove, it's like, it's a trigger everywhere that this is how we operate, But I started reading our reviews, And that's where it really hit me. Like, if you read our patient reviews, if you read our patient satisfaction surveys that come back, if you listen to the parent testimonials and things, or even just unsolicited, I mean, go on Facebook and go on Google, and like, the most common comment was that place loves my kid, or we love going there, you know, like, my child loves going to DiMaggio. I mean, that was like, for me as a children's hospital, who wants to go to a hospital? You know? And so when I start reading that regularly, and then I even had a father say to me at one point in time, he said, "You don't have to tell me that you love my kid. I know it. I feel it." And I was like, that is the ultimate, you know, like, just confirmation that everything we're doing is something that people remember how they feel, even when things are imperfect. We've had incidences where something goes wrong, you know, and we have to tell the family, like, you know, we go and we disclose and we share, because, you know, we're always striving for zero harm, and we're striving for highest quality of patient safety and quality, but sometimes we miss. And so many times the parents are like, don't, like, we know you love this child and you didn't do it to hurt them, you know? Like, I mean, it's just funny how, like, setting that whole culture, setting up the whole environment, the whole community, that's what it is. Even when things go wrong, they're like, we love you anyway. You know, that's kind of what we get, because we're honest with them, we're open with them, we include them, you know? It's very different.
You reminded me of there's a quote that I often, by often I mean always, use in my keynotes from a network technician who heard me speak years ago, and he's talking about how important love is, and he said, "I've been telling my guys as technicians ever since I became a manager that we want our clients to love us. So they need to love you, take you home to dinner, love you, meet the wife and kids, love you." Because he said, if the customer loves you, you could blow up their building and they'll say, accidents happen.
Mm-hmm.
It's exactly what you're describing here, right?
It's very similar.
Because we're human, and in being human, that means we're not perfect.
Right.
So the question is, you know, where is the relationship when things don't go according to plan? And if the love is there, you get grace in return.
Absolutely. In fact, you know, it's funny, we were just meeting this morning about our safety and quality program, and that is everything here. Like, everything. I mean, I could give you a whole other podcast about just what we do here to keep safety at the forefront, and how well we perform because of how our teams are empowered and they feel invested and all that stuff. And when you're talking about medical errors, you know, when I came here, again, this place was amazing to begin with, but I think one thing that we could improve upon was giving people the safety and security to come forward. Like, if you see something, say something before it becomes a problem, you know, or if there are near misses or system changes we can make, let's do it so it never happens to anybody, right? Let's get ahead of it. And that was like this big push, big shift through something that we're involved in. It's a national children's hospital quality thing. And it's funny, we were looking at our data today, and our incidents, like the number of reports, went way up in the last 3.5 years, almost 4 years since I've been here. So we have people that are not afraid to tell us when things are going wrong, but the number of harmful events have gone down.
Interesting.
So they go hand in hand, because if you're telling me about these incidences where there could have been harm or there was harm, and we acted and we fixed the system, or we retrained, or we, you know, re-educated, like, in theory, you would have less harm events. And, you know, do you know how, like, we give like millions of doses of scary medication every day. It's like how that's possible. It's amazing to me that over those years of just making it safe. to
Yes. Well,
say.
that's that is a very concrete indicator, both of those things. The higher incident reports, and at first blush it might even seem counterintuitive to some people, but it's really not. It's a sign of trust and love in the environment. If I trust you,
Right.
I'm going to tell you. And the fact that the harmful uh, results went down is also a sign of trust, because what it says is that you're listening and
Absolutely.
responding when people
That's
report.
the key. Like, that's the key, that the hospital acts like we've
Yeah,
made actual change, and the staff know if I report it, they're going to fix it.
right.
So it's not for naught. Like, it's not a waste of my time to put this in and just tell them something's happening. They're going to help us fix it. And the other thing that was interesting today, the head of our quality department was sharing that the other thing that I really wanted to do kind of early on, we weren't ready just yet, but they did it in the last year and a half, was start to, when we look at incidents when they happen, like, so we have these, okay, so there was a medication error. Invite everybody. Like, don't talk about it like it's like, oh gosh, like 10 people in a room and we just talk about it amongst ourselves and then we figure out what. No, you should tell everybody that it happened, because then they're much more hyper aware. So now what we do is we report every incident or every near miss every day at our safety huddle. So did anything happen overnight? Did anything happen yesterday that people need to be aware of? And then we do it at like our we do something called Just Culture, where we review an incident. Well, we invited all the staff to come listen. So instead of like 5 administrators behind a closed door talking about the error you made,
Right.
it's you and your team and everybody else who might want to sit there and go, that could have happened to any of us. Like, and that's often what happens is the nurses will say, that wasn't my error. That could have happened to any of us. So we need to hear that from them. So it's kind of interesting that, like, this whole concept of leading with love, and we're not perfect people and nothing's perfect, but we can sure try for every kid every time for it to be zero harm, zero error, as perfect as we can be. That has opened up this acknowledgement that, like, we all know we're not perfect, but we all care deeply and we do what we do with the love and the intention. And then it's a safe space. And it's for me as a CEO to tangibly see that our staff are reporting more than ever and that we have less events. I'm like, we're on the right track.
So how common is it for somebody to report their own error?
Here,
Yes.
very, very,
So
very.
I screwed up. I overlooked this. I neglected to find
Absolutely.
that. It happens a lot.
Oh yeah.
Wow.
Yeah. Because, and sometimes we rank them, like, it's like not rank in the sense like how bad was it. It was just more like, was there harm, because the more harmful events go into a very different kind of problem solving mode. Like, if there was a medication error that almost killed a child, we're going to handle that differently than something that was, we gave her an extra Tylenol too early and it didn't, but we still report it. So, you know what I'm saying? And they're both the same problem. They're just different medications. Like, so for us, it's like a system issue. So they're all important. If things did not go the way they were supposed to, let's figure out why. And more often than not, it's not human errors. More often than not, it's something that could have been in the system. It could have been an alert. It could have been a medication check. It should have happened in the medical record. It was a communication breakdown. Sometimes it's with the family, sometimes it's a language barrier and we didn't bring a translator in appropriately. Like, I mean, I could give you days and days of examples where the system broke down, period. Or sometimes you have errors where they're like, we call it like a Swiss cheese model, where it just, like, everything that could have gone wrong did go wrong.
Mm-hmm.
And, so, but you have to look at all of your faults if you're going to not make the same mistake again, or build a process and system in to avoid it for anyone. And, again, this morning we were looking at, like, a medication issue that we found in our medical record. It didn't have a double check on a dosing for children. And, we have Epic, it's a very large system. They implemented the change across the entire, anybody who has Epic got the new check because we caught it, we reported it. So, I mean, that's the level of comfort. You're talking about people here that are very invested in, that's why for reports, we get them every day. And then just how severe they were, how much harm, and what the approach is to solve for them. That's what's different, but we want to know them all.
So it seems to me that this is true for any organization, but in the healthcare field, hiring the right people on a values level.
Yeah.
I mean, you want the best possible talent, knowledge, expertise, and they also have to have the right value set, right?
Yeah. Oh,
So
for sure.
Have you ever found like that person, a specialist, let's say, who was just incredibly qualified,
yes,
but personally just not a fit?
Oh, 100%. That happens here all the time. In fact, as a health system, overall, I think the statistic is like we hire like 2% of all the people that apply because we screen them for values overall. And then Joe DiMaggio is particularly stringent, but the way I like sort of describe it to the staff is we've hired you for your heart. We can teach you what you need to know. I mean, you're coming here with basic skills, you have experience, and we know what we can train you up to do, but you either are or are not one of us. You either are or are not Lotsie. You either have some of her in you or you don't. You're either going to hold the door open or you're not. I can't train that into you. So we try really hard to screen for the people that, heart first, then head. And like in terms of, choices.
And that's true.
Order of magnitude.
It seems like that'd be true at every level for, let's say somebody who's a valet, like you were talking about before, to a surgeon.
Yeah, absolutely.
The
in
same
fact,
thing applies.
Yeah, it's funny. Our health system CEO has a story he tells at every employee orientation, which was, there was a really amazing surgeon, like internationally known, who wanted to come and work at our health system, but he was a LeBron James, like he was a team of one, like he wanted to be the star, and that, but we passed because this culture is all about the team. It's all about supporting the team. And if you can't be a team player, you're really not going to do well here anyway, because we do everything as a team. So that was like, that's a typical story of like everyone at all levels. I really can say that here has a common heart, has a common value system. And the things that happen here, like the stories that have happened here, would never happen anywhere else, And I mean, I'll give you one, just a quickie, that there was a child in the community years ago who had a very rare disease, and we were trying to figure out what to do, and it was happening and progressing quickly. And so one of our ICU doctors was taking care of this kid for a couple of days, and then he was supposed to go home and rest. And so the new doctor comes into the ICU, and this doctor says, I'm not leaving this child. Like, I need to see this through, because this is happening so fast that if someone's not in here all the time, we're not going to be able to stay on top of it. And this other doctor has to take care of other patients. So I'm going to stay with him. And the parents will never forget to this day. The kid comes back every time he's home from college now, because he's a Duke. And he comes and visits because they will never forget that doctor like slept in his room for days. And I can't tell you, I don't know if you know any doctors that would do that in the hospital, but he just felt like, we have to keep this kid alive. Like, we can figure this out, but I need to give them the attention. And that's just so much an indicator of what happens here versus other places. That's, to me, that's really what the love is. That's the secret sauce. It's like, that's the kind of above and beyond that you only give when it's part of who you are. I can't ask you to, I can't train that into you. It's either there or it's not.
So to what degree can Joe DiMaggio, your love culture, and what it looks like and how it operates, to what degree can that serve as an example of what's possible in any hospital? not just a children's hospital?
Well, I think I would go back to the data. I mean, like, that's why I was saying today was remarkable to see that like, it can translate in the approach, like not everybody's going to have the exact same setup that we have. And not everybody's going to have the CEO like me that's just, I want to just be one of the kids all day, but you can learn from our system of creating a trusting community, creating a, quality and safety being attached to that approach. Like those are, I think, things that we can train and share and, those best practices. In fact, our patient satisfaction scores is something that we often get asked about because we have two of the most prestigious patient satisfaction awards that you can get. And even through COVID, we kept them. So, even though we were, these poor families were going through so many more difficulties and we had all these restrictions, we still got 95th percentile in patient satisfaction. And then the other one, it's the Press-Ganey Pinnacle of Excellence. You have to have 95th percentile for like multiple years in a row and without a break, and people always want to know, like, how did you do that? And we cite so many different things. One is just that we involve everyone, we involve the families, we involve our teams. We try to create an environment that's safe and comfortable and, whatever, secure for our children, our staff, their families, the community, and then really focus on designing the experience around what that child is going to ultimately need. It's support, it's familiarity, it's control. The reason why they get to order chicken nuggets at 2 a.m. is because they can, they're hungry. And if they were home, they might be able to do that, or like they can go to the playroom at 2 a.m. It's open. Why? Because if you woke up from anesthesia at 2 a.m. and you want to play. Like, so we try to give them that whole, I think people can learn from our approach about why families say such good things about being here, why staff come and stay. And it's the same concepts. It's just, really thinking about what's going to be best for that child, what's going to be best for the team. Like that, those are all just principles that we live by.
Do you ever have other hospital systems come and have these conversations with you?
We do. Yeah, we did a case study with Press-Ganey. So like for our patient satisfaction, there's a whole case study on their website. And we did like a interview thing. And then we've had with Plaintree, which is our person-centered design, there was another children's hospital in Australia that wanted to go for it. And they became the second children's hospital in the world to get it. But they came here and they stayed with us and we gave them all of our ideas. And so, yeah, we definitely get looked at as a best practice. And even locally, I mean, we have competition around us and most people that have been to both places know the difference with coming here. It's just a very different vibe. Like I always say, when you walk into DiMaggio, you feel like someone just gave you a big hug. It doesn't feel formal. It doesn't feel hierarchical. It doesn't feel corporate. It doesn't feel cold. Like people are friendly. People are helpful. Something fun is going on. And then we're about to just take that to a whole other level because we're building 4 stories onto the Children's Hospital, and the Garth Brooks Teammates for Kids Foundation helped to bring to us through a very generous donor, a child life zone. The whole 8th floor of the hospital is going to be a movie theater, a green screen, a sound studio that connects to all the other zones in the country and Garth and, and then, just a play space that's safe, art therapy, music therapy, classrooms so you don't get behind in school. Like it just takes it to a whole other level. Like that's going to be like the heart of the hospital is that 8th floor where all this activity is happening just to keep the environment light, so even if you're getting chemo pumped into your body and you have to drag around your IV pole, you might as well be playing video games and having fun and watching a movie or playing with the green screen because it's your universe here. You should be comfortable.
Wow, what an incredible story. I just feel like I would love to see an adult hospital.
Yeah.
I know. I mean, one hospital.
I know.
Just try this experiment and see if you could create something analogous for
So true.
for adults. I mean,
Yeah, I
I
know.
have a client that I spoke to recently, a healthcare system. I spoke to a couple of thousand of their leaders, and they are talking about love in
Mm.
their culture, and it's really important to them. And I would I would love to see them come and hang
You
out
and me
with you.
both. Yeah, and I have to say, with the adult hospital thing, like I've always wondered, especially for like the geriatric population, there like a lot of the needs developmentally are very similar. Like why we have all these resources in a children's hospital doing what they're doing is to create an environment where the children thrive, they go home, there's less trauma, there's a lot of support, people explaining things to you in a way you understand. I always found that to be strange that like there wouldn't be the geriatric equivalent of that. Even the little things like, we take so much care when we're going to give you an IV or we're going to draw blood from you. And we have a million things we do. We have different kinds of numbing creams. We have different kinds of, our ice packs that look like bumblebees, or maybe you don't like bumblebees. Maybe you like something else. Maybe you like Batman. We have Batman, whatever. Like all these things, we take great care of making sure that when we draw blood for you, there's no trauma. And then you see like some of these older people where like they just keep poking them and poking them and poking, and their veins are tiny and they're on blood thinners. And like, you're just like, of all populations, I just never really understood that. Maybe someday, I hope in my lifetime that happens. But I always tell people, if I get sick, you take me to DiMaggio.
Yeah, I've had that thought more than once over the last hour.
Yes,
oh my
I
gosh,
get that.
Caitlin, this is what an incredible example, and thank you for being such a great model of what love looks like in such a tangible way.
Yes, well,
And
thank you.
so if people wanted to learn more about Joe D and about you, what's the best way? Just do you go to the website, or is there some other way?
Yes, jdch.com. You can just look us up there. I'm on LinkedIn. I do a lot of posting on LinkedIn, and people connect with me there all the time. We've hired people who are like, I know who you are. We also have our capital campaign called Catch the Love. So that's our philanthropic. That's jdch.com/give. And I will say, actually, on our website, on the main page, there's a link to our tour. And even if you just Google JDCH or Joe DiMaggio Children's Hospital Tour, it's for kids by kids. So you'll see that when we did the tour video, I remember when I got here, they were like, oh, will you be the tour guide? I'm like, who wants to see me tour? I mean, let's let the kids, then they'll see that it's not scary. And that's actually usually most people's introduction to the hospital. Like we send that to parents and they show the kids, oh, this is where you're going. You'll see what it looks like, what it feels like. It starts that ball rolling. So if anyone's curious about the hospital, I always tell them to watch the tour.
Great. And we'll be sure to put all the links on the blog post.
Okay, cool.
So people can just click and check you out firsthand, which I highly recommend everybody do. So thank you so much. Thank you so much, Caitlin, for joining me.
My pleasure.
Maybe we should do another podcast where you could tell us about your safety protocols and all that. It'd be really fascinating to hear.
So impressive. Well, thank you, Steve. I appreciate the opportunity to talk and hang out.
Absolutely. And to everybody tuning in, until next time, do what you love in the service of people who love what you do.
Thank you for listening to another episode of Love is Just Damn Good Business with Steve Farber. Join us again next time, because when customer and employee satisfaction just isn't enough anymore, we are here to back you up with specific ideas to operationalize love to make an enormous difference in your business, personal life, and the world around you. Visit our website at stevefarber.com to leave a review. And don't forget to share the love with your colleagues and friends, because after all, it's just damn good business.